Well, on this episode, we are switching things up a little bit and we are actually connecting with not physicians but providers, but with two leaders in our health system who really focus outside of just your physical wellness of what you might consider when you come to one of these facilities to see someone getting treated for medical conditions. They really focus on your full well being. And we are talking to them about social determinants of health, which Ben, I don't know about you, but for me, that is a fairly new term that I hadn't really heard of. And so I was really excited to connect with them and really hear how they are caring and how we as a ministry are caring for the whole person and all of the factors that impact your health from if you have access to food, if you have access to transportation, where you live, anything that's really stressing you in your life that may impact your full well being. I thought the conversation was really interesting and really resonated with me of how we care for truly the whole person who comes to see us. What do you think?
Yeah, I think that that's definitely a big part of this is understanding the whole patient, their whole situation. And it also really speaks to our mission as a healthcare organization too. We're we're doing this for those most in need.
Mhm.
And it's part of our service. It's part of just reaching out to meet people where they are and understanding what's contributing to their healthcare issues. So it was really impactful to hear how much work Rob and Bentley do to make sure that we're kind of covering all those bases when speaking to the patient.
Definitely. Well, we're really excited to share this conversation with you. And it was important to us while we typically connect with providers and physicians, it was important for us to share how we can care for you in all of the ways that you need to be cared for and what you can really expect when you visit us and what this information that Bentley and Rob are getting from you, how it helps our providers care for you as a whole person. Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently. Healing you means hearing you. Let's talk. I'm Lexi.
And I'm Ben. And today we're joined by Rob Tasman and Bently Senegal, both with Our Lady of Lourdes Health. Rob is Vice President of Mission Integration for our Acadiana Ministry, and Bentley serves as Director of Community Services for Our Lady of Lourdes Health. So welcome to you both. Thanks for being here.
Thank you.
Thank you.
Nice to be here. Yeah.
Yeah, great to be with everybody. Well, we're glad to have you. So let's start by learning more about you and your work for Our Lady of Lourdes Health. I'd love it if you guys could just kind of share about your career paths and how you found your vocational calling and perhaps how you've been able to answer it through your work with our health system. Bentley, I guess we could start with you.
Okay. My background is a little busy. I went to school here at USL, majored in accounting. My background is finance. I have a degree in accounting from USL. I'm a CPA. And I started out as a Medicare auditor for like 15 years doing Medicare and Medicaid cost reports. From there, I went to work for Lafayette General here in town and then came to Our Lady of Lourdes about 22 years ago. So I've done finance for most of my career, but the last, I guess, 12, 13 years, I've been working in mission community services, doing a lot of outreach for Our Lady of Lourdes Health. And that's the short version of it.
Rob, you as well. How did you come into this vocation?
Yeah, sure. So I went to Boston College as an undergrad and graduated with a degree in communications and theology. I went and taught in a Catholic high school for 2 years and then went back to school again at Boston College, got a master's degree in theology in Christian social ethics. So that's perfect for the conversation today with regard to social determinants of health, community benefit, and making sure that we touch those who are underserved within our populations. But from there in grad school, I met my wife, Katie, who's from Baton Rouge, and I followed her down to Louisiana in 2004. So I've been in Baton Rouge from that time until just 2 years ago. Once I got to Baton Rouge, I taught again for 1 full year and then went to law school at LSU, completed law school, and straight out of law school went to work for an organization called the Louisiana Conference of Catholic Bishops, which is really the government relations public policy arm of the Catholic Church in the state. So my job was to be at the Capitol every day during the legislative session, and really proudly, from my perspective, be able to provide a voice to many who don't have a voice within our society with regard to legislation and the creation of law. And it was during that time that I met many individuals, great leaders who work for our health system. And when it was time for me to recognize that my time had come in that organization and I needed a new challenge, I was fortunate enough that an opportunity had opened itself here at Our Lady of Lourdes. So I've been here now for the last 2 years.
That's wonderful. We're glad to have you both to push our mission forward and outreach to all our community members. I'm sure there's no typical day and that you juggle a lot of things as they come your way, but can you share just a little bit about what a day in the life looks like for you? What's your routine? Or it can be personal, work related, any of that.
I'll defer to you, Bentley.
Well, typical day for me, as I said, back in the day when I worked in finance, I was the controller here at the hospital when we built the hospital and Ambassador Calf. But I've always worked in community services in between the numbers. And I worked with Sister Betty in Mission. And when I started working in community services, I felt that it wasn't something that I had to think about doing because I did it all in between the numbers, Rob. I shared with you before. I always felt that there was a soul, there was a person behind the numbers. So it was just a transition. I didn't have to switch caps because I was doing it already anyway. And I felt like behind those numbers, there were people, there were souls. And that's what I did. I tell everybody that accounting is what I did, but community services is who I am because that's really where my heart is. But a typical day, I have St. Bernadette's Clinic. That's the clinic for the homeless, under resourced, under uninsured population. And then we have Northside School-Based Health Center, which is in a low risk area of our city. And we see those students there that are from low income homes with a lot of issues, none of which they've created themselves, but a lot of times that's where they find themselves living in single parent homes or with uncles, aunts. Some are homeless, even some of those seniors are homeless. So, and then we have the other third ministry that reports to me is called Congregational Health Services, where we partner with churches of all faiths. We go in and we set up a healthcare ministry to help them manage their care. Like say if a church has a lot of diabetics, we'll bring in speakers and to help them understand how to prepare food, how to take insulin and things like that. So my day is never the same. But every day that I wake up, I said, okay, God, what are we doing today? What's on the agenda for today? How can we make somebody better than they were the day before? And that's what I do every day.
That's powerful. What about you, Rob? What's a day look like for you?
And Bentley and I, we have a lot in common, and I think that's why we have a passion for working together with one another. My maxim to myself when I started healthcare, I realized that my gosh, it's not a job you will ever get your to do list done, right? I mean, you end your day and it's just not done. You end your week, you got to roll it over to next week. So my prayer each morning as I drive into the parking lot is, God, not what obstacles are you to present me with today, but what opportunities are you to present me with today, especially with regard to trying to help people. So, my job is interesting. It has many different facets to it. Obviously, being a Catholic healthcare institution is to make sure that we maintain a strong Catholic identity. And that itself means many things. Some of that also means making sure that we're compliant with the ethical and religious directives. So there are ethics requests that come through. But the thing that I think I appreciate most about my day and that I get the most enjoyment out of is creating relationships, whether it's with our team members, whether it's with colleagues, especially also too with community partners. So Bentley knows this better than anybody, but just like every other facility in all the markets that the health system exists in, Lourdes has a phenomenal footprint in the Acadiana region. And so for us to maintain relationships with those partners can only benefit those who really need certain resources and assets that they may lack at a time. Bentley and I, we feel like we're brothers at times and we're both relational beings and we eat that up and we see that as a benefit for us to be able to do the work in an effective way.
That's good to hear. Some good insights and kind of works nicely into what we want to talk about next, which is our health system has worked to build diversity, equity, and inclusion into all areas of our work. We've made a commitment to investing and improving to ensure that diverse and inclusive environments are here so that our patients and team members and the communities that we work in can all thrive. One of the ways we do that is by addressing those health disparities and inequities. We know that more than 80% of someone's health, their full well-being, is determined by factors other than illness or medical conditions. And that's what's termed as their social determinants of health. So I was curious how you would define social determinants of health in your own words for someone that might not be familiar with that. And Bentley, we could start with you on that.
Okay. When I think about that, there's so many definitions out there for social determinants of health. But, I've been dealing with this for a long time. And just in my own words, I would describe it or define it as a non medical diagnosis that affect health outcomes because it's that serious. I look at it as, when we look at a diagnosis on the medical end, we run tests, we try to figure out what's going on, we come up with a treatment plan, and we do follow up. That's what needs to happen with social determinants of health. We need to figure out what it is. We need to dig into it, come up with a treatment plan, and we need to follow up on it. Lourdes Health have been doing a lot of this before it was popular. I mean, with COVID, we learn of the health disparities which were already there and those social determinants of health. One of the big parts of my job is to do the community health needs assessment and our implementation plan. And of course, this year, health disparities and social determinants of health was one of the things that Lewis decided that we were going to identify to the IRS and then also address. And that's what we set out to do. Lourdes and the FMOL is doing a great job of tackling these things. I know we're probably going to talk about that later. But when I define, I know that's what you asked me. See, you can tell I'm passionate about this stuff, Rob. Talk about it all day. But
That's right.
I would define it and answer your question as a diagnosis, non-medical, that should be in the chart and figure out. And once you drill down, what's the treatment plan for that diagnosis? And that's just me. That's just my
Yeah.
definition.
Yeah, I think from my perspective, I view it as those things that stand in the way of our ability to thrive as human beings. Right. So for me, I believe in a God that creates us to thrive, not merely to survive. And so, with that in mind, anything that stands in the way of being able to reach your full capacity and full human fulfillment, then I think that's an obstacle that we've got to address and that we've got to look at. Social determinants of health for me also very much mean the front end of the issue, right? So, in the clinical space, as Bentley well knows, I think that's what he's alluding to as well. We deal with individuals who come to us with sickness and ailments, and we try and address those. But how much of that might be influenced by these other dynamics that are not clinical? And if we get those at the front end, what does health outcomes look like then as a result on the back end? We can always be, reactionary, but I think it's really important for us. And I'm proud of our system now that is looking on that front end to be proactive and see how we can participate.
Yeah, that's really great to hear. And just for those who may not be as familiar with it, can you touch a little bit on what are those non-clinical things that may be specific to causing someone either an illness or at the root of what could be bringing them to us to begin with?
Yeah, some of them are education, housing, environment, things like food deserts, things like that. They wouldn't look at that in the past, but we see it firsthand, like at St. Bernadette's, Rob. When we come, we had a patient that had some type of, I think it was a cut or sore. So Bridget patched him up and she said, you know, so go home and clean it with water. And he said, well, I don't have water. So we had to give him bottles of water. You know what I mean? So that's something that's it's a medical condition, but for him to get well, we have to figure out those other things. He was, I should tell him, go put your head up. He said, well, I'm going to put my head up under a tree. I don't have a home. Those things affect health outcomes. But I think we've overlooked them for a long time, thinking that, another thing is we would write prescriptions for those at St. Bernadette's, but they had no way transportation to get there. So what we did is we started giving them bus passes because we felt like if we're gonna, all we were doing, Rob, was putting a Band-Aid on the problem. We tell you, this is what you got, and here's your script and buy, but we've learned not to treat them and street them is what we call them. We follow them through to get them to get their medication. And so those types of things is where, like I said, we've been doing it for a long time, but I think through COVID, it was highlighted and magnified, but we saw it all the time. And what we do in our ministry is we see a need, discover a need, and we try to meet that need. And holistically, from start to finish is how we try to do it.
Yeah. Yeah, you raise a great point too, Bentley, because I think also too that's reflective of the history of the sisters, right? The Franciscan Missionaries of Our Lady, who founded this ministry. I always tell people, if you want to sum up really quickly what they're about, they identify a need and they propose a solution. And we see that in so many ways. It's just what you said. I think about things too in terms of social determinants of health, like food insecurity, right? So, I mean, if an individual doesn't have access to good, nutritious foods and they're ailed by something like diabetes, then the more processed, high sugar foods they eat, they're never going to get out of the cycle of really being able to treat the illness that they have at hand and the disease that they have. So, food insecurity is another one. And Bentley and I talk about this a lot too. I find it interesting. It kind of connects the two lives that I've had professionally, but access, right? Access is a major issue for individuals. Bentley alluded to it with regard to transportation. It's fine to set up a clinic somewhere, but if you can't get there, what good is it, right? So I learned real quickly when I started working for healthcare here in the ministry that a lot of the work that we had done at the Capitol that I was able to participate in on behalf of the bishops, for example, making sure that we had Medicaid expansion in the state. That's all well and good from a public policy perspective, and I have no regrets about that. But what does it actually look like practically? So we gave over 400,000 people in the state an insurance card, which we should have, and that's wonderful. But if they can't use that card to actually access a doctor, have we really solved anything? So these are some of the dots that I think we need to try to connect and make sure that we're really getting to the root cause of some of those issues.
Yeah, because a lot of people, if I can just add what Rob said, Medicaid expansion did not guarantee access. That's what everybody thought. I often say that they're all dressed up with nowhere to go. And that's what happens. And just one quick story about the food, Rob. We're next door to St. Joseph Diner and our St. Bernard's Clinic. And what was happening is they would come, they would go, they were eating for survival, whatever they fed them in the soup kitchen. Then they would come to us with obesity and diabetes and stuff like that. And I prayed about it. I said, something's wrong with this picture. And that's why I wrote an FMF grant. Thank God for FMOL HS grant for a dietary plan where we can give them fresh fruit and healthy food. And they come back and we saw the obesity come down, the diabetes under management, the weight come down. And these were for homeless people. When you talk about social determinants of health, like I said, we've been doing it for a while. I mean, before the lights came on, we were here. The sisters Sister Betty recognized that you have to go where they are. And she said, meet them where they are. And what I added to that is meet them where they are, but love them too much to leave them there. That's help. That's how I look at it. And that's the story how we closed that loop because we were meeting needs, we finding the needs, discovering the needs, but what you're going to do about it. And that's what the community health needs assessment is all about. The IRS said, okay, when you identify these needs, you can't just leave them alone. You have to tell the IRS in an implementation plan, what are you going to do about it? And if you're not going to do anything about it, once you identify it, you have to tell them why. You might say, well, we identified mental health, but that's out of the purview of what we do. But we gotta make sure that we partner with another community partner to see that that need is met and things like that. So that's what we do every day. Rob and I mean, we do that every day, in this ministry. Yeah.
Yeah. Thank you for talking through that. I think that those are, I think, huge issues that are going on everywhere that are not addressed by other organizations. And so it's really great to see that our ministry is really taking the forefront and the lead on that. And you mentioned a little bit about the assessment and other things that we do, but I'd love to hear more just about how our health system is really meeting people where they are and working on initiatives that provide care for patients as a whole who may need, like you said, extra love and support.
Yeah. So I guess I'll jump in real quick, Billy, on this one and just say this, our health system is moving in a direction where we're utilizing Epic, our medical record system, to be able to identify some of these social determinants of health. So our clinicians are at being able to ask the questions and then identify those needs. And certainly here at Lourdes, we have our own case managers who can try and assist those individuals. But I want to mention a third party that we use too, because they're just incredibly invaluable here within our community. And it's not to take anything away from what we do internally, because it's one of these beautiful partnerships that I think any good organization needs to have sometimes. And so it's called Beacon Community Services. We'll reach out to them when we can identify some of these needs within social determinants of health, and they have their own case managers. They'll then be able to pick up that patient that we have. And the beauty of it is they'll follow that patient for as many as 3 months. So, when Bentley says love them to the point where we don't leave them there, right? I mean, we want to make sure that we see them through so that it's not just a simple call, a referral, or something like that. It's a human relationship that we're fostering to be able to see the success hopefully come from it and see the fruit that's potentially yielded from it. So that's one of the things that we do here at Lourdes. And I would also highlight too, I know Bentley, I'm sure, is going to talk about it, but I don't think you could say enough about something like congregational health services, which we have here at Lourdes, because to me, that's really the boots on the ground, the grassroots kind of effort that we do to partner with populations within our community. I think it's important to focus on the fact that, a lot of people, they want to jump in right away and do something and they feel like they have the answer. But you really can't suppose you have the answer unless you're first with the people who have the needs, right? So be with the person before you can be for them. And then once you identify that, man, working together, you can accomplish phenomenal things.
You kind of mentioned some of the specific work that's taken place in Acadiana with this congregational health services, but then also St. Bernadette Clinic. Was curious if there were any other examples that you could share of that specific work that's going on in Acadiana right now.
So like it's St. Bernadette's, that we've had St. Bernadette's Clinic. It was a vision of Sister Betty Lyons for over 25 years. We've been there. And it's in an area where there's a homeless shelter right next door. Some of them live outside in tents and things like that. One story we had, because there's a soup kitchen, St. Joseph Diner next door. Then you have St. Bernadette's Clinic, which is right in the same building. And there was a gentleman, I go there all the time and I can go in through the back door, Rob, but I always go in through the front door because I like to talk to them and just hear their stories. And, when I go in through the front and the staff say, well, you can come into the back. I said, no, I like to go in through the front. I like to be with the people, Rob. I gotta feel
That's
them.
right. That's right.
Saying, and so there was this one gentleman, he met me outside and he said, I lost my job. He said, but I came to St. Joseph Diner and they gave me food. He said, I need a physical. I went to St. Bernadette's Clinic and they met my medical needs. He said, I didn't have teeth. We have a dental clinic where we got him dentures. And so right on that corner, we met all the needs of this one gentleman. And he came to me and he said, I need $20. I said, okay, dude, what you need $20 for? That's, yeah. He said, I need $20 because guess what? Got a job. I got a place to stay. I just need to buy me some deodorant and some soap so I can go to work clean. I was in a rush to a meeting, but I stopped and I listened and I made a difference in that man's. Every time he see me now, he said, I'm still working. So just that little thing, you know what I mean? Sometimes I often say, sometimes we're in a rush to get somewhere, but I always tell myself, don't pass up ministry on your way to ministry.
Yeah, that's a great story. I think you end up where you need to be, right?
Yeah.
You're meant to be with that person instead of in that meeting.
Yeah. Yeah. Cause
Mhm.
sometimes, cause God will take care of what's down the road. But today, that good Samaritan, don't pass it up. Sometimes we do it, right, Rob?
Absolutely. Yeah. Yeah. And I love to, Bentley, that story because there's something very basic about humanity where we just want to be acknowledged. Right. And I think we should be acknowledged because then that highlights the fact that we all have this inherent dignity that God bestowed upon us. So, I mean, stopping to talk to the individual, listening in the encounter, actively listening, right? Not just kind of sitting there, but actively listening. That's all a form of acknowledgement. I think about it in my house. So my wife, Katie, and I, we have 4 boys. At the dinner table, it's like competing voices all the time. I'm like, guys, we got to mute one of you, so we can understand what the other's saying. But it's all because they want to be acknowledged. But that's in a home where there's, I hope we can say a lot of love and a lot of attention. And for some of the individuals that we deal with, they're out there all by themselves trying to face these challenges that are just uphill battles. So when we have those opportunities to encounter them in a way, walk with them on their journey and just acknowledge them, I mean, what a gift that is to us, not even necessarily to them, but just a privilege for us.
Right, right. And even at St. Bernadette's Clinic, I mean, they walk in, we have a vision program. We treat them, diabetes, whatever they have. We have mammogram program. Some of the women that come to us have never had a mammogram, a pap smear. We do that. We send them if they find something to our imaging center for further testing. We have the dental clinic where we do tooth extractions. We do some heart testing with Heart Hospital, carotid screenings for them. And if we find something, we'll send them. So, it's whatever the need is, we try to meet it and we do something about it if they come to us. Because I just believe, and I tell that to Jay all the time, Rob, who's our foundation executive director, that when God gives us a vision, he always make provisions. And I tell you, every time that something comes up, we don't know how, when, or how it's going to be funded, but he's never let us down. And I just believe that that's how I know the great work that we do here. The sisters started it so long ago, and I think the footprint that they've made and the path that they've set, I often say that they've passed that baton to us, Rob. Now it's our turn to do something with it. And I think that's what we do every day, is to make sure that they're extending and casting that net. Because like I said, I was the controller when we built the hospital, but I knew at that time that not all the people and patients was going to come in our four walls. We had to go outside and meet them where they are. And we do great work in the hospital. But I tell you, when you walk outside that hospital, we don't let them down, because some of them, they don't have transportation. Some won't come to the hospital. Some of those patients that we have, they have Medicaid, but they don't even know what their social security number is. They don't know, but they'll come to us because they know we're going to take care of them at St. Bernard's Clinic. Yeah.
That's wonderful. On those same lines, I'm curious because I'd like to know how you're able to share these successes with the community and even with like our civic leaders, just to explain how important our health system is when tackling this issue. And I was curious if there was any like specific data that you could share about the impact of this work in the community and the results that we're giving.
One of the, well, I'll just speak from my end. One of the things that we do is we partner with a lot of community nonprofits. We just did something with United Way where we rolled out the results of our community health needs assessment. And a lot of the community partners, they want to partner. Like, we have dentists that come in and volunteer with us. They leave their practice and come in and volunteer because they love the work that we do at St. Bernadette's. We see about over 3,000 patients a year in medical visits, and we in our dental clinic about 500 patients there. Then at Northside School-Based Health Center, about 1,500 visits a year there for those students. We do a lot of immunizations, sports physicals, and things like that through the consents of the parents. So, and once we do the community health needs assessment and we do the implementation plan, I speak at a lot of engagements in the community and talking about what we do and how we do it, and how long we've been doing it, and how we do it raw with joyfulness of spirit. We don't just serve, it's just how we serve. And it makes a difference because there are people in the community that are doing some things, health fairs and things like that. But the way we do it, it just has something special to it. And I think the people in this community have come to know that when you come to any of our facilities, you're going to get something a little bit more than in medical care. It's going to be some help here at the highest powers, like we used to say it back in the day.
Yeah, if y'all haven't realized by now, before Bentley leaves the ministry, and he's got plenty of years left, we need a book with all of his maxims because he's got some great sayings. Yeah, and I guess I'll just piggyback off of what Bentley said too, because one of the ministries we haven't really touched upon is Northside High Clinic. Bentley just mentioned that. That's a phenomenal one too, because that's a school-based health center in you think about it, right? I mean, it's a public high school here in Lafayette, and we've got a Catholic healthcare ministry operating an entire wing with a fully functioning medical center there. Most people would say, well, what about the separation of church and state? But fortunately, Lafayette says, well, we see the results, and this has been a phenomenal partnership. Correct me if I'm wrong, Bentley. I think it's the longest serving health center in a school in the state of Louisiana.
In the state of Louisiana, and it's the only one in a high school in our parish here in Lafayette. Yeah,
Yeah.
25. It's called, well, I keep saying 25 years. We're almost at 30, Rob. I've been saying 25 for a long time because it sounds good, but we're almost at 30. And that clinic, it's more than a clinic. And it's more than a clinic because not only do we take care of their medical needs, some of these kids don't have anybody to believe in them. They'll come in there and they'll show their prom pictures and their homecoming pictures to our staff because they want somebody to meet them where they are. And I'll go there sometimes. They'll come in and they want to see the nurse practitioner. And by the time she talked to them or the social worker, they'll find out that perhaps, they hadn't eaten in a few days, or they had to go stay with uncle or aunt, and things like that. This is a story that's really gonna just every time I think about it. We had a student there. She was a senior. She was homeless, Rob, and she was the valedictorian of her class.
Wow.
And her
Wow.
next place to stay was going to be on her dorm campus because she had nowhere to live. That tells you that these students, they're not looking for a handout. They were looking for a hand up. Just somebody believing. How do you be a valedictorian and you're homeless, living from here to here to there? That's why we're on that campus. That's why we believe in what we do. That story. And that's just one. I mean, if you had a few days, I could talk about this stuff. 'Cause
Yeah.
it's just something about the work we do in the community that's just set apart. It sets us apart from because of the way we do it.
And that's a great story too, Bentley, because you can have all the measurements in the world, right? I mean, you can talk about how the clinic at Northside cuts down on absenteeism and truancy and improves people's ability to stay in school. But it is so much more than that too, at the end of the day. I mean, it really is. We had this great experience recently, Bentley. You were a major part of it where we had students from Northside High come to Lourdes. They got outfitted in scrubs. They spent the entire day here. They got access to operating rooms. I mean, they had a full experience. And I just thought to myself, what an amazing partnership. I mean, we have the privilege of being in their location. And now we're blessed with them being able to be with us physically for a day. And hopefully it opened their eyes and their hearts to some possibilities in healthcare for their own careers in the future. And that's one of the parting things I got to say to those 30 students. I said, hey, look, you're all not necessarily far away from the possibility of being employees here at Lourdes. And what an amazing day it would be if you came up to me and said, hey, a couple years ago, I was sitting in that classroom and you talked to me and now I'm here and we're partners, we're colleagues. I mean, that would be amazing.
And one of the things it did, Rob, just about to add just right quick, it connected our hospital to the clinic that they go to every day.
Yeah.
They never made that connection. They thought it was the school board, even though they see the sign, but it connected those two things. And now they understand, we may be, the hospital may be on Ambassador Caffrey, but we've extended the healing ministry to you at Northside across town. And I made them make that connection. And I'll tell you, when they left with those scrubs on and went back on campus, y'all can imagine with the other students, where you been? I want to do it next year. And every time I
Yeah.
walk
Yeah.
campus, they're like, when we going back? So that was a wonderful experience. Anytime you can plant that seed, Rob, and
Bentley and I talk about it a lot too. We talk about it as being a mission beyond the walls, right? So as he said, I mean, he was part of the building of the hospital here. We know that people are going to be able to come to us, but there are so many that are not. So we got to extend the mission beyond the walls of our facilities and into those communities.
Yeah, we definitely do. And it's really inspiring to hear those stories, especially just the relationships that are formed between those partners that we have, but then also with the individuals that we're serving. And it's refreshing really because I know we like to refer to ourselves as a ministry of relationships. Our health system is a ministry of relationships. And we're really focused on serving those who are most in need. And that sounds like what we're fulfilling with the social determinants of health and the programs that we started. And I'd really love to hear just your take on what would you say about our approach to serving those most in need and how that lives out the teachings of who we are as the Catholic Church and our connections there.
Yeah. So look, Lexi, to me, it's everything, right? I mean, if we stop doing that, then I move on and I go work somewhere else and pursue something else. I mean, I just wouldn't be interested in it otherwise. I mean, it's so much part of our identity and who we are. From a Catholic perspective, even from a Christian perspective, I feel like the work connects us straight to the gospel stories. And I think that's incredibly powerful. There's nothing quite like it. Part of my job is just wanting to make sure as the vice president of mission that we're truly authentic to that because we talk about it as the great differentiator between us and other healthcare organizations. And I think it is. But we just have to make sure that in all that we're doing, and you can hear of what we are engaged in, that we elevate that, right? There's always going to be this tension between mission and margin, right? Because you have to have a sustainable healthcare industry financially. That's completely understandable. I have no problem with that at all. But making sure, though, that we then reinvest what we're able to make from a margin standpoint into the mission side of things is how I think we bring all this to life and continue it as we move forward. I just think it's probably one of the things I'll share with you, going off on a tangent, but I get excited about this topic myself. So, people, during times of disaster and major needs within communities, a lot of people would be asked, I want to contribute, I want to pitch in, I want to give. And, you have some pretty flashy, sexy things on TV, like, dial a number and you get to talk to a celebrity and make a donation. But I've always maintained that from the Catholic healthcare system and from Catholic organizations in general, whether it be Catholic charities, whether it be Catholic relief services, we have been here and have had a presence for years and years and years and proven that we can deliver the resources directly to the people who are in need. That is the same with Catholic healthcare. So when you ask, well, what does the identity look like? You can't separate the two. And the minute you do, then you need to really take a hard look at yourself in the mirror or just walk away and say, I need a clean break. I need to get back on track.
And just to piggyback what Rob was talking about, most people, well, maybe they know because I say it a lot, that I'm Baptist, and I was, when I chaired the Mission Integration Committee for several years with Sister Betty, because when you talk about Jesus, he said the poor will be with you always. And Catholic healthcare have been doing that for years. Every time I think about our ministry and how we extend the healing ministry, Jesus said, when I was hungry, you fed me. We do that. When I was naked, you clothed me. We do that. That doesn't have a religion attached to it, but it's the love of Christ for the poor, who he said will be with you always. And we've recognized that. And I love working here. We're very ecumenical here. And Sister Betty and I would talk about a lot about what we had in common rather than the differences on how we worship. That we know that one God is the God that allow us to do what we do every day in our community. And I think Rob would agree with that. If I'm not, he'll correct me.
I'll give you an amen on that one, Bentley.
All right.
I think we could all give an amen on that one for sure.
That's
Yes.
right.
Um, well, Bentley, I was thinking back to your story about listening and how that plays into every day when you walk in at St. Bernadette and you're walking in through the front door and you're meeting people there and being very open with them. I was curious for both of you if you had any kind of stories to share on how the role that listening does play in your work, because we're dealing, I guess, with populations where it might be hard for them to come to you to share what's going on in their lives outside of just their health. But this is such an important part of the work that we're doing. So how does listening play into that work?
Yeah, particularly, well, and not only at St. Bernadette's, but a lot at Northside School-Based Health Center, because we have a social worker there. And I tell you, we could probably use about 4 of them, because these kids, with what's going on in the schools today with the shootings and the killing, a lot of COVID, a lot of mental behavioral health issues. And many times they'll talk to some of the students, and by the time they peel back the onion, a young girl is pregnant. It's the reality of what we're dealing with, but we're there for them. If we wouldn't be there and we wouldn't listen, then we would not be able to get them help, because our social worker there, she's awesome. And they keep coming back to her because they feel comfortable with her, and talking with all our staff there, because we all know that they don't have to come to us, but they feel comfortable coming to us, because at the school, Rob, I don't know if you know that, they have counselors and social workers, but they come to our clinics. They'll go through them to get to us, because they feel like we'll be more confidential. It's something about Catholic healthcare that resonates to people, that is spiritual. If they see humility, they see that everybody is accepted, and then when we look at the patients at St. Bernadette, 90% of them they're homeless. They have some type of substance abuse or mental health issues and stuff like that. So we have a nurse practitioner program where we started that she specializes in mental health, and she listens to them. And some of us would say, well, they don't make sense. But when she talks to them, they make a lot of sense. And they really tell us what they need, because sometimes we assume we know, Rob, and what you know might not be so, until you talk to them and you find out what the need is. And so that's where the listening comes in. So if you want to get down to the bottom of it, talk to them. They're going to tell you, because some people say, well, St. Bernadette. And I'm like, no, No, you have to you got to go get the real tea, as they say, to figure out what's going on, and they'll tell you what's really going on. You know, ask Brit, our practitioner. She'll go sit on the curb with them and get the tea. Like she'll skip to a test, and they don't, because they're very transient. They don't come back for their follow. So she goes and find them. And sometimes I'll drive there. She's sitting there, and I said, "What you doing?" She said, "I'm just fine. I had to hear his story to get him back in the clinic, so then I can treat whatever he's going through." You know, nobody goes to those great lengths, but we do. We did, because you know why? We're never going to make a difference with population health until we fix disparities, until we fix social determinants of health. We can do all the stuff we're doing, but until we do this, that's the missing link. Until we get everybody healthy, a healthy community is going to make for a healthy world, a healthy city, and all that stuff. And that's our goal. And that's what we do every day.
Yeah. I had a story recently too. I'll share with y'all because it actually was within the facilities of our hospital here within the walls. I have the privilege too of being able to assist and partner with our palliative care team. And so this was a situation in which he was an adult male who, was essentially on life support. We were trying to figure out who the decision maker was in the family. And it happened to be a son, but the son lived in Texas and he had an estranged relationship with his dad, didn't have too much. But the man had three adult sisters who lived in Alexandria, Louisiana. And so the son said, I want to defer those decisions to my aunties. They're with him, they know him. So we had to wait. They came in, and, sometimes in healthcare, people want to make real quick, expedient decisions, right? Like you want to know the answer, you want to move on and get the job done and check your boxes. But sometimes the power of taking the time to really have the encounter goes a tremendous way. So in this case, the three sisters came in, the three adult women. I went into a room with our palliative care nurse practitioner, and we started having a conversation about some of their desires. And we learned so much that we didn't know. I mean, there was some frustration on the medical staff about what should we do? Who should we honor? We've got to make a decision quick. What we learned in the conversation was tragically, these three adult women had lost their mother 6 months ago. They had lost another sibling, another brother 3 months ago. And now they're staring at another sibling, their brother, who they stand to lose right now. Additionally, he had a power of attorney and a law post form, but they questioned whether or not he even knew what he was signing because the adult man was illiterate. I mean, you talk about the social determinants of health. I mean, somewhere along the line, the system had failed this gentleman such that he was in his 60s, 70s, and had never learned how to read or write, but he was able at least to always put something on paper. So we had a conversation with the sisters. We said, look, we'll make a copy of the signature for you. But our nurse practitioner began to describe to them what the signature looked like. And they broke down in tears because they said, yeah, that's our brother. That's exactly how he used to sign every document. I mean, taking the time to listen to them, to know what their realities were. Obviously, that's what they were dealing with and struggling with. That was their suffering. And that's why they couldn't make a decision as quick as some others wanted them to. The real question about their brother knowing whether or not what he had attested to because of his illiteracy, that's a major question that anybody, of right mind should be able to ask and have a sufficient answer to. The outcome was very positive at the end. They felt very comfortable. We were able to honor everybody's wishes. And, on a lighter note, Bentley will appreciate this, but we didn't begin that encounter with a prayer like we usually do because our nurse practitioner was just eager to jump right in. And I let her take the lead. So I said, can we end this time together with a prayer? And they said, of course. Well, they were three Pentecostal women. So Bentley, I started to pray in my usual Catholic way. And these women started responding to everything I said. My gosh, I was ready to be a Baptist preacher by the time I was done. My adrenaline was kicking in. I think that was one of the best prayers I ever said. So it was just a wonderful encounter, all based in the spirit of being able to listen to one another and have that true dialogical experience.
That's a great story and a powerful one too. I think it shows, and you guys have already shown that with the stories that you've shared about how challenging some of this work can be. I'm sure it's pretty easy for you to explain this, but I'd love to hear what keeps you going and what makes this work so rewarding for you.
Well, for me, I think it's rewarding for me because we're being obedient to what Christ expects from us. In his word, he tells us what we should do. We're going to follow in his footsteps. We're to see about those that are less fortunate than us. And I think some of the challenges in doing the work is, as Rob mentioned it, it's always, some, not always, but it'll come down. They often say no margin, no mission, that you can't do the work, is being able to fund some of the things that we do. But we do a great job here where we make it a priority when we can, and there have been times over the years that I've been here that we had to kind of, do something different. But it's like when you do the work of Christ, number one, he's glorified. And number two, he's going to work it out for our good. It may not be exactly how we think. Sometimes I don't know how we're going to meet the need, but Rob, it seems to always work out. And that's what helps me go to sleep at night. Sometimes I go to sleep and I want to wake up the next morning. I don't sleep because I'm ready to go fix whatever God, he speaks to you sometime in the middle of the night and said, this is how you solve this problem. And that's what makes it worthwhile for me, is if I can help somebody as I walk along this way, then my living won't be in vain. That's how I look.
Yeah. 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 That's beautiful, Bentley. I would say that's why I feel like you and I are so connected. I mean, I've never been able to do something in my life that wasn't bigger than me. It's got to be bigger than me. That's what drives me. That's what motivates me. That's what fulfills me. And certainly my faith has always been important to me. So to be able to have that in this nice, neat package of Catholic healthcare and have it be so consistent is just perfect, to be honest with you. I'm not a huge country music fan. I do listen to it. I like all genres of music, but there was this one song and it was a lyric that stuck in my mind, and it had something to the effect of saying that, have you ever seen a hearse with a luggage rack? And of course, the answer is no. You'll never see a hearse with a luggage rack because you can't take things with you when you pass on. So the best that you can do is leave something behind that's lasting. And I think that's what this work affords us the opportunity to do, is leave the world a little bit better than we received it. If we're blessed, then we need to try and pass that on and share our wealth. And I define that in the broadest sense possible with those who just don't have quite as much as we have. And I think that's really being consistent with the gospel itself, and certainly the section that Bentley mentioned, which is, Matthew 25. That's the clearest direction.
Yeah, that's so great to hear. Just the why behind what you do is so inspirational to us. And then I know to our listeners, it's really going to resonate on the theme of country music or music that you listen to. This is a fun just question for us. We like to ask our guests, what are you listening to these days? So could be music, could be, podcasts, audiobooks. It could be fun or it could be professional. We're just curious what's on your sound wave.
I know Rob is into rap music, so yeah.
That's true. That's true. It's true.
Um,
Yeah.
I listen to a lot of jazz music, because it kind of takes me away from I love jazz, JB Sachs, Rob, I'll go to
Yes.
he's
Yes.
like son that I raised. He's not my son, but he's like a son that he was in high school playing the saxophone, and he's doing he's a professional musician now. So I like a lot of jazz music, instrumental jazz. It kind of makes me think outside the box and just give me that, kind of brings me down a little bit, because I'm always up here, and I need something to bring me down, because I'm always feeling like it's something I should be doing. But that's what I'm doing these days, and listening to music. That's what I do.
It is. I love to try and look around at different sources too, like TED Talks, for example, and things of that nature. Whether it has to do with the topic of leadership itself, or just whether it has to do with any kind of interesting topic about anthropology or humanity itself, I find that to be sources of inspiration at times.
Yeah. Well, also curious about what excites you about the future of healthcare and what we can offer communities, and specifically too about the future of Catholic healthcare as well.
Well, Robert's probably better can answer that, but let me just put my little 2 cents in it. I think what excites me about the future of Catholic healthcare is the footprint and the path that they've rolled out for us. Because we just didn't start doing this yesterday. And they've been doing it for a long time, and we've been doing it for a long time. And I like what I see, and I don't see them stopping anytime soon. There's they've proven that they're going to be led by the Holy Spirit to help those most in need. And I just believe that we're on the cutting edge of something great, and we've always been. And I just like where I am. I'm like I said, I'm not Catholic, but Mr. Bud Barrow used to tell me, Rob, that I'm the most Franciscan Baptist he ever seen. So, well, I just love God. I love God's people, and I love church. So so that's my title. But no, but I really think that we've started something, but the job is not over with. And I think as long as we're here, we have a job to do. And I think the way we serve and the way we do it, it's unmatched, especially in this community that we work in.
Yeah. Yeah. Yeah, and I think honestly, from my perspective too, one of the things that excites me is certainly the topic that we were talking about here today. Because as we talk about social determinants of health, to me, it's reflective of the fact that we're really trying to address some of these health disparities and health inequities in a different way than before. So it was easy, I think, in the past to kind of sit and say we're a Catholic healthcare center and people come to us and we serve them. But it's totally different to enter into the ambulatory space, for example, with some of our outreach clinics that we have and maintain mission there. It's totally different to look at the social determinants of health and try and stop and stem some of these issues before they actually get to us. And I think really where the frontier is now for Catholic healthcare as it tries to adjust to the very competitive landscape that healthcare is today is it's going to be in different partnerships and joint ventures and things of that nature. That excites me because, in the background that I have, I've always said that the black and white is way too easy. I like the gray where it's messy and you're really trying to problem solve and critical think and figure things out. And that's going to present a lot of that for us as we go forward, I believe. But I think building off of what Bently said, it'll help us extend that footprint and touch people in different ways. And to me, that has always been one of the gifts of Catholic ministries is that we don't aim to proselytize. We don't aim to shove these things down people's throats. We just aim to live it out. And if that catches on and that's a form of evangelization that people awaken to, then all the better, right? So, I mean, you go back to St. Francis of Assisi's quote, preach the gospel always and use words only if necessary. That's it.
That's wonderful. Thank you for sharing that. It's great to hear that. Yes, while we are a Catholic health system, there's room for everyone to have space to be who they want to be and need to be and can still make an impact, just being who they are and sharing the things that they care about.
What you just said, I think it speaks volumes that in Catholic healthcare, I'm a believer because I live it, that the tent is big enough for everybody.
Yeah. And then I would say, based off of that, too, just do the very best you can because we're all guilty of it because we're all flawed human beings, but do the best you can to try and remove judgment from your life because it's a lot of what we're talking about, too, with social determinants of health. There's a lot of shame associated with it by the individuals who face some of these challenges. And the reality is, we don't know their stories. We haven't lived their lives. They were born and entered the world exactly as we did, the exact same way. And whatever circumstances that they were dealt or what they've had to deal with has led them to the point where they are right now. So let's not get involved in that judgment. Let's instead just open our hearts and extend whatever mercy and compassion and empathy and resources that we can.
Well, thank you both for being with us and joining us and sharing your expertise and your stories and your heart. We really appreciate it.
Thanks for having us.
Yeah, it was a great being here. Appreciate it.
Yeah, thank you. Listeners, thanks for tuning in. We'll have everything we mentioned and more helpful resources linked in the show notes. Subscribe to hear future episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
If you have ideas for topics you'd like to hear about on the show, email us at podcast@smolhs.org. Thanks for listening.